Have you ever returned from a walk and thought, I've been bitten by something? I love to go hiking, but I've often returned from a long walk or a hike and thought I've been bitten by something. I notice sometimes I feel itchy and I can see a bite mark, and then I wonder, what has bitten me? Well, did you know that a tiny tick bite can lead to serious illnesses like Lyme disease? Well, if you've been bitten, sometimes you might see the tick in your skin, but this isn't always the case. So how do you know if you've been bitten, and what are the symptoms you should be watching out for? In this video, I'm going to go through what you need to know. What is Lyme disease? Lyme disease is an infection caused by a bacteria called. It usually spreads to humans by a bite from a tick. A tick looks like this. It's important to note though, ticks can come in varying shapes and sizes depending on the stage of their life cycle, but they're usually quite small. Ticks can range from the size of a poppy seed to a sesame seed. They typically have 8 legs. If you can see a tick embedded in your skin, count the number of legs and there should be 8. And remember, they're normally quite dark coloured, reddish brown. How do you get Lyme disease? Lyme disease is transmitted to humans by a bite from a tick that's infected. These ticks, which are carrying the infection, are usually found in wooded or grassy areas. And it's important to remember that Lyme disease is on the rise, so you need to be aware of the symptoms and watch out for any bites. Why is it important to recognize the signs? Well, it's crucial to recognize the symptoms early on and get the right treatment to prevent the disease from progressing. Lyme disease is sometimes divided into 3 categories: acute, early, and late. If you have Lyme disease and it's picked up early and you have the right treatment, this generally leads to a good outcome. How to spot Lyme disease. Number 1, rash. The signature rash from a Lyme tick bite is often described as a bullseye rash. It's normally a solid red oval. It can appear anywhere in your body. It's normally a red spot surrounded by a clear circle with a wide red circle on the outside. This rash is flat and usually is not itchy. This rash is a sign that the infection is spreading through your skin and generally gets bigger over time. Around 30% of people who have Lyme disease never noticed a rash. The initial red rash appears at the site you've been bitten, but it can take between 3 and 30 days to appear. Similar but smaller rashes can appear weeks later as the infection starts to spread. My top tip as a doctor is that if you notice you've been bitten, stop and take a photo of the insect. If you notice there's one still in your skin, take a photo at the time and take a photo as your rash develops and changes, especially if you're away from home and traveling. This will allow us to follow up your care in the most appropriate way when you get home. For example, you may need blood tests or further investigations, a specialist referral, so if a patient can show me a photo of the insect or the rash, I'll have a better idea about what's going on. Next symptom, fatigue. Early symptoms of Lyme disease are generally described as flu-like. You might feel a bit more tired or exhausted and a lack of energy, which is not usual for you. Number 3, achy, stiff or swollen joints. Joint pain and stiffness that's coming and going can be common symptoms of Lyme disease. You may even notice that your joints are inflamed, red or painful. If you're noticing that you're having aches and pains which are not common for you, this could be a clue. And another useful clue can be if it's more than just one joint: headaches, dizziness and fever. As I mentioned, the early symptoms of Lyme disease can be flu-like symptoms. So this can include fever, dizziness or headaches. Around 50% of people who have Lyme disease have flu-like symptoms within around 1 week of getting the infection. And it's useful to pay attention to the symptoms because the fever is usually low grade, so not really high. Night sweats and sleep changes. Sleep changes are a common symptom of Lyme disease. Advanced symptoms of Lyme disease. As Lyme disease progresses, your symptoms will also start to change. Some people can get neurological symptoms. These symptoms can include numbness, tingling, or even paralysis. As the infection spreads, some people notice a cognitive decline. This can mean you have difficulty concentrating or thinking as you would normally. You may feel as though you're processing information much slower than you used to. Due to the numbness and tingling and the neurological changes, you might notice it's more difficult to move or walk than usual. You may feel off balance or just more uncoordinated than usual. This can happen as the Lyme bacteria infect your nerves. Another complication of Lyme disease is if your heart gets affected. The Lyme disease bacteria can invade your heart tissue. In these circumstances, you may notice chest pain, lightheadedness, palpitations, or feeling more short of breath. Some individuals also notice mood changes. You may feel more irritable, anxious, or even depressed. Summary of symptoms. So now, in this video, I've gone through the early symptoms, so generally flu-like symptoms and noticing a rash, and then I've gone through the more advanced symptoms. So what should you do if you notice any of these signs or symptoms? Well, it's important to see a doctor early on so we can give you the appropriate treatment. Usually you need a few weeks of antibiotics to help get rid of this infection, so the earlier we treat you, the less likely you are of developing the complications. How is Lyme disease diagnosed? A Lyme disease diagnosis usually involves seeing a doctor where we'll ask you lots of questions about your history and your symptoms, ask for any photos that you may have of the rash or anything you want to show us. Then we may do some lab tests where we try to check for antibodies that your body is fighting the bacteria, and also to try to rule out any other potential causes of your symptoms. And remember, with these symptoms, they can be quite vague and difficult to pick up what exactly is going on, so we may need to rule out on other diseases like rheumatoid disease or thyroid disease. Can Lyme disease be spread from person to person? Well, this is a common question that my patients ask me, and the answer is no. Lyme disease is not transmitted from person to person. It's only spread by being bitten from an infected tick. However, if you've been traveling in a tick environment like a forest, make sure when you get home you check your clothes and you check your pet so you're not taking any ticks into your home. Is Lyme disease curable? Yes, Lyme disease is curable, but it's important for the infection to get picked up early. I hope you found this video useful, and if you can click the subscribe button, it really helps my channel to keep growing.